All right. Well, good morning and welcome to Backyard Naturalist. Um, as always, we want to say thank you to viewers like you on this Valentine's Day. Without subscribers, this program wouldn't be possible, and you too can become a Backyard Naturalist subscriber. A standard subscription gets you access to weekly lectures and a subscriber appreciation party, and you can become a super subscriber to also get access to our monthly field trip series, Green Spaces with Familiar Faces. Our next Green Spaces trip is going to be next weekend, next Saturday, February 22nd, and it's going to be with ornithologist Bill Mueller. And he's going to take us to a little spot along Lake Michigan and talk about why he likes it. Um, and then the following weekend, I believe, yes. The following weekend, March 1st, we'll be joined by Cheryl Nen from Milwaukee Riverkeeper to talk about her favorite spot along the Menominee River. Individual trips are $20, or you can get the entire field trip package, the remaining 10 for 110, or they're included if you're a super subscriber. And if you haven't had enough of the snow or you're itching to get out, and can't wait until next weekend, we have a Take It Outside Day tomorrow at Riverside Park. So you can stop by between 10 and noon or 10 and 2 to try out cross-country skiing for free. There will be equipment to borrow and plenty of people there to help with ski and boot sizing, as well as to teach you the mechanics of cross-country skiing. And you can go outside and try it out yourself. There'll also be sledding and, of course, some warm drinks and a cozy fire. You're more of an inside person. Tim is going to be back next week to talk to us about quinoa, but as a reminder, our last Friday lecture of the month, February 28th, we won't have a program. It will be UEC's Wellness Day, a day for staff to take some time for themselves to rest and recharge. So we encourage you to do the same. But if you're missing us next Friday or on 2 Friday mornings, you can head over to our YouTube channel and check out our catalog of past episodes. And just check, and there are over 200 episodes in there for you to peruse. But let's get into the topic of the day, which is heartworm. Heartworm, or Deerflaria immitis, is a nematode that infects the heart of carnivores. Nematodes are a phylum of roundworms that can either be free-living or parasitic in nature. There's about 28,000 species, 16,000 of which are parasitic. The modern Latin compound nema means thread, and then odes means like or of the nature of, so thread-like, as nematodes have this thread-like structure to them. They're slender and small worms. Most are less than 2.5 millimeters long. Many of them are microscopic, and their body is very rigid between their cuticle and these longitudinal muscles running along the entire length of their body. It creates a pressure-filled cavity that helps maintain their shape and allows them to move. This essentially creates a hydrostatic skeleton for them. They're typically dioecious, meaning they have separate male and female individuals. Males have copulatory spicules, which allow them to attach to the female for reproductive purposes, and they can be a diagnostic feature in the identification of many species. The general life cycle of nematodes, all nematodes, whether they're free living or parasitic, is pretty much the same. Generally, eggs will hatch into larvae, which are outwardly very similar to adults, but lack a developed reproductive system. They'll go through several growth periods and molt until they're reproductively mature. So they'll go from L1 to L2, L3, L4, and become adults who will reproduce and start the cycle all over. Parasitic nematodes include ascarids, which are some of the largest nematodes. This one, Ascaris mycoides, is a parasite of humans and can grow between 6 and 19 inches long. They're actually the most common parasitic worm in humans. Not so much in the US, but across the world. Other parasitic nematodes that you might be familiar with include hookworms, whipworms, pinworms, and filarial worms, which is what we're going to be talking about today. Heartworms are a type of filarial worm, which are a superfamily of very highly specialized parasitic nematodes. Filarial worms all have an arthropod intermediate host and then a vertebrate definitive host, that vertebrate being not a fish. Filarial worms of humans are major neglected tropical diseases like elephantiasis, or also known as lymphatic filariasis. This disease is transmitted by mosquitoes and can cause the nematodes themselves can cause obstruction of lymphatic vessels, which lead to tissue swelling and damage, which can create this lymphedema in the limbs. One other filarial parasite of humans is Onchocercaria, which is the cause of river blindness. This parasite is transmitted by a black fly, and the larva and the adults can cause these very itchy nodules. They can also transmit to the eye and cause blindness as they move throughout the body. So I'm going to give a little warning right here. If you don't want to see a worm on an eyeball, you should look away for the next slide. So in some cases with this particular nematode, the microfilaria will migrate to the surface of the cornea, which causes inflammation. And in chronic infections where this goes untreated or undertreated, the cornea can become damaged, making it appear opaque, which leads to the loss of vision. Okay, you can look back if you were looking away, but probably the most common filarial nematode, at least in our part of the world, is heartworm. Heartworm primarily infects dogs, domestic dogs, but can also infect cats, wolves, coyotes, jackals, foxes, ferrets, bears, seals, and sea lions, and very, very rarely humans. It, like our other filarial nematodes, is vectored by an arthropod, in this case, a mosquito. At least 25 different species of mosquito have been found to carry and transmit heartworm larvae. The mosquito will feed on an infected host and ingest larval nematodes circulating in the host's bloodstream. And then within the mosquito, they'll start to mature. The larva will start to mature to their first larval stage, L1, as well as molting to the second and their third larval stage, at which point they are infectious. When the mosquito goes to feed on a new host, the third stage larva will emerge in the saliva, also called hemolymph in this case. And they can infect a new host by entering the skin through the puncture that the mosquito created to feed. The larva will then develop into their fourth larval stage subcutaneously, so within the skin. The L4 larva will migrate throughout the tissues, and then roughly 7 to 8 months post initial infection, they will settle in the hearts and lungs where they'll become sexually mature. Adult worms will mate and release microfilaria or baby nematodes essentially into the bloodstream where they can infect a new mosquito host, and then the cycle will repeat. On very rare occasions, the microfilaria can end up in abnormal locations within the host, like the eyes in the brain or spinal cord, which can cause vision problems, seizures, and other symptoms. Adult worms can grow up to a foot long. And if untreated, the adults can increase to several hundred worms and live inside a dog host for 5 to 7 years. Within the heart, the worms induce pulmonary endothelial damage, and they activate as well as attract a lot of leukocytes and platelets, which causes a lot of damage to the heart and the lungs. This can cause pulmonary vessels in particular to thicken and become tortuous. The presence of the worms themselves can also reduce cardiac output just because they're themselves a large blockage in many of the vessels, which can result in pulmonary hypertension, which can lead to heart enlargement as well as heart failure. Living with heartworms, adult heartworms particularly, even for a very short period of time or in a relatively light case with few adult worms, this can cause severe damage to lung and heart tissues. You can cause lung disease, heart failure, and as well as damage to other organs, which can last beyond the treatment of the worms. As in humans, pulmonary hypertension results from the narrowing of the pulmonary arteries, in this case, not because of things like plaque, but rather the worms themselves. This not only causes heart and lung problems, but can also lead to damage to many other organs, including the liver and the kidneys, and it can increase the risk of blood clots. In the very early stages of the disease, so when they're initially infected, particularly with larvae, up until the adults settle in the heart, they may show very few or even no clinical signs. Once adults are settled in the heart and the lungs, and they increase in numbers, some symptoms that a dog may show include coughing, exercise intolerance, including fatigue after just mild activity. They may show some decrease in appetite as well as weight loss. And as the disease progresses, dogs may develop heart failure. They'll get that enlarged heart. And then they might even start to retain fluid, resulting in edema. With a very large number of worms, infected individuals can experience sudden blockages of blood flow, which can lead to death if untreated. Dogs with confirmed heartworm diagnosis need to restrict their exercise, and they'll be treated with several different drugs, including antibiotics, antiparasitics, and depending on the severity of case, steroids, diuretics, vasodilators, fluids, as well as other drugs to help stabilize the dog. The treatment itself can take several months. And like I said, it includes a plethora of different drugs, including antibiotics, which nematodes are obviously not bacteria. So why treat with antibiotics at all? Because of the presence of Wolbachia. This is a gram-negative bacteria that infects many species of arthropods as well as filarial nematodes. In the case of nematodes in particular, it is a symbiont, which benefits both the bacteria and the host. In this case, in nematodes, the Wolbachia is provided with amino acids, and generally the nematode is provided with basically some kind of reproductive benefit and may even be needed for them to survive. All heartworms are thought to be infected with Wolbachia to some degree. So when treating for heartworm, the inflammation that occurs as a result of the die-off of adults when treated with an antiparasitic, um, this inflammation might be due in part to the release of Wolbachia into the tissues. Additionally, the elimination of Wolbachia from nematodes is shown to result in their death or sterility. So treating with an antibiotic like doxycycline prior to giving an antiparasitic lessens that effect of the inflammation and as well as reduces the transmission potential of heartworms since it can either kill adults or cause infertility. So during treatment, dead worms can break loose and travel to the lungs, which can cause respiratory failure, which is why a heavy reduction in exercise is a must. Once the adult worms are dead, they have to be reabsorbed by the body, so that takes some time. And then the microfilariae, so any baby nematodes circulating in the bloodstream have to be treated separately. So this is why this treatment can take many, many months. In other mammals, heartworm can look a bit different. So dogs are the definitive host, but like I said earlier, it can infect many different species, particularly carnivores. With other canids like wolves, foxes, coyotes, as well as in seals and sea lions, they can show very similar clinical signs. But in cats and ferrets, heartworm disease looks a little bit different. In these cases, heartworm disease is not treatable. There is no treatment that is approved for cats or ferrets. Luckily, they are atypical hosts for the heartworms, and so infected cats in particular usually have like 1 to 3 worms or no adult worms at all. This does mean the disease often goes undiagnosed. And because the disease is not treatable, and even though immature worms can cause a lot of damage and they can live within a cat for 2 to 3 years, prevention is really key. With cats, clinical signs can be very subtle or very dramatic. They can include things like coughing, vomiting, lack of appetite and weight loss, as well as fatigue. More severe clinical signs include seizures and sudden collapse or sudden death. Human cases are very rare. I think there's been, since like the 80s, about 120 cases reported in the US in humans, but we are dead in post, so infections tend to be relatively innocuous. The major issue with when heartworms infect humans is they can cause these coin lesions that appear on X-ray, which can often be confused for more serious problems that humans encounter, things like lung cancer or tuberculosis. And so when these coin lesions are found, typically you have to have a biopsy, which can be somewhat invasive. But when the biopsy comes back, it is always, well, not always, but it will be diagnosed as heartworm, which doesn't need to be treated in humans. Our immune system will just take care of it. In animals, it's a bit simpler to figure out if they have heartworm. Typically, a blood test is all that's needed. So you can perform a test called a blood smear. This allows for the examination of larval motion, and it's typically done when there is a suspected infection. Chest x-rays can also reveal heartworm infections. In dogs with heartworm, the heart may be enlarged and there will be white areas in the lungs. But more generally, pets that don't have a suspected infection will get tested yearly with an antigen test. This is kind of like your COVID rapid test, where these types of tests are looking for antibodies or antigens produced as a result of a heartworm infection. So typically, your vet will test yearly, conduct this test called a 4DX test, which tests for heartworm as well as three tick-borne diseases. So Ehrlichia, Borrelia, which causes Lyme disease, and Anaplasma. These tests aren't quite as simple as your at-home COVID tests because they require a blood sample rather than saliva or a nasal swab, but they're very useful nonetheless. Heartworm in dogs and cats is very easily preventable with a monthly chewable or topical treatment. And many of these treatments also provide protection for other parasites like fleas, ticks, as well as other intestinal parasites like hookworms and roundworms and tapeworms. It's equally important to have cats on a monthly preventative, especially since there's no treatment available to cats. And roughly only 1 in 10 cats are on a preventative, even though their risk is pretty much the same as in dogs. And so, of course, right now we're in the middle of winter and there are no mosquitoes out. So why have your dog on a preventable or your cat on a preventable? Um, since we're in winter, the risk of infection remains relatively low, and it's predicted to remain low over the next 30 days in Wisconsin. But the fact is that adult heartworms can take 6+ months to develop after your pet is initially bitten by an infected mosquito. And how monthly preventatives work is by killing the larval stages of the heartworm before they can become adults and cause damage. This is really why year-round prevention is important. In addition, heartworm really used to be primarily restricted to the southeast, but incidence is on the rise, especially as climates change. Last year, the heartworm incidence in Wisconsin remained relatively low. Roughly 1 in 300 dogs, or 0.35%, that were tested were positive for heartworm. They think, however, this data that's collected and compiled by the Companion Animal Parasite Council is estimated to be less than 30% of the activity in the region. So incidence of heartworm might actually be much higher. But ultimately, heartworm risk is going to depend on mosquito presence and abundance. And where mosquitoes persist depends on a variety of different factors, including humidity, habitat availability, particularly for the larval stages, which need water, as well as heat at night. So as you can see in this map, the eastern side of the country is where mosquitoes are particularly bad because of all these variety of factors. When mosquito season is kind of depends on your latitude, basically what standard season we're following. So for us, it would be around early May. But they're finding that mosquito season is changing in a lot of cases, some places more strongly than others. In Milwaukee, over the past 40 years, on average, mosquito season has increased by 2 days, which isn't a ton, but in some places it has increased much more. Like in Jacksonville, nearly 20 days. Longer is a potential as climates change. And of course, mosquitoes don't just carry heartworms. They carry a lot of other diseases that we are susceptible to as well, like West Nile virus and Zika. So it's important to protect both you and your pet. And how we do that is by staying indoors when mosquitoes are most active, which is around dawn and dusk. You can use a mosquito repellent of your choice. DEET tends to be the most effective. Not everyone loves to use DEET, so there are plenty of other effective mosquito repellents. Also, just wearing clothes that cover most of your skin, and draining any standing water. You can, of course, protect your pet with a monthly heartworm preventative. And so that is it. And I'll take any questions if anyone has any.